Hi, I'm Dr Kyla, paediatric dietitian, fussy eating specialist and mum of two. I'm the founder of the online Mealtimes memberships that help parents just like you experience a confident and guilt-free way of feeding children. I'm also a business owner, a hot cross bun lover, and my superpower is finding things that you cannot live without. In this podcast, I'm talking about feeding your family, along with a random selection of topics that tickle my fancy. Welcome to Mealtimes with Dr Kyla. Welcome to today's episode. Today's guest is Dr Nelu Simonsz, paediatric consultant and one of the loveliest kid doctors you'll ever meet. Side note, she has the most beautiful range of dresses that she wears to work. I am very jealous of some of them. She's got 3 young kids herself and is juggling all the things, as well as sharing evidence-based information on social media to address some of the rubbish health advice doing the rounds at the moment. Welcome, Dr Nelu.
Hi, Kyla. I'm so excited to finally chat to you. We've been Instagram buddies for a while, and now we can actually see each other and chat. It's really nice.
We've moved on from DMs to face-to-face,
We have.
online face-to-face podcast chatting. The good times. Tell the viewers, no, not even viewers, tell our listeners a little bit about you.
Yeah, I'm a general pediatrician. I work out in a regional hospital in Victoria, and I do all sorts of things. I do work on the wards, I do hospital in the home. I have an allergy clinic, and I have an infant and baby allergy clinic as well. And then I've got my own baby, so I've got a 4-year-old and 2-year-old twins. And we've been through all the things with the reflux and the cow's milk and F-pies and everything between my 3 kids. So I understand being a parent of a child with allergies. And I buy all my clothes on Facebook Marketplace.
Really?
Yeah.
In like the buy, swap, sell groups for specific brands?
Yeah, or I just go hunting and yeah,
Okay.
I don't like spending lots of money on new clothes. So I just wear all secondhand stuff.
I have never even thought to look for. Do you look for specific brands?
Yeah, Zimmy and Gorman. I don't know if I'm allowed to say that, but that's pretty much
Yeah,
all I wear.
of
But
course you are.
yeah.
Resale. All right, I might take that up myself. I'm currently trying to find a bike on Marketplace. And as a side note, is there anything worse than Marketplace sellers? Like, I
Oh,
message someone like, I would like to purchase this at the price you've put on. And they write back like, okay. And I'm like, great, when can I come? And then nothing. Like, oh, actually, I sold it. I'm like, "What?"
yeah,
Anyway,
it's annoying. It's annoying, but I still nab myself
worth
for some
it.
good bargains. Still worth it.
Worth it.
And I've got a whole pile of stuff that I need to resell that doesn't fit me. And I don't know when I'm going to do it. But if anyone
Put it
wants
on
to
the
buy
list.
some Zimmy, hit me up.
We'll hook up our own little Instagram buy, swap, and sell. All right, let's talk. We were talking on Instagram in the DMs a bit about the kind of frustrating advice that we're seeing dished out to parents that we're working with. And personally, as a dietitian, I am consistently wild with rage about some of the feeding advice I'm seeing dished out on social media. So I can only imagine how you feel when this actually presents in your clinic or in the hospital. Do you know, when we're talking high stakes here? So today I'm thinking that we can address some of these myths and perhaps compare them to what the evidence suggests and what you'd recommend instead. Because I'm guessing that you see a lot of this in your clinics as well.
Oh, Kyla, I do. I do a lot of internal sighing when I have families who come to me who have been given incorrect and sometimes unsafe advice. And a lot of what I do in my clinics is undoing information that families have been told, redoing it safely, and then following them up. And look, just like anything, a lot of it is 100%, but what we do practice is evidence-based, and a lot of information that is given out is not evidence-based. And a lot of it's fear-mongering and unfortunately exploiting families who are desperate.
And I
And
think
also,
it's so hard for families, right, to sort through evidence. Like if somebody's telling you this is what you need to help your child with eczema, for example, like I just don't think that parents should have to sort through information and work
oh,
out what is factual and not. Like it's unbelievable.
absolutely, it's not their role. And the problem is you can Google, you can put
Mm.
anything into Google and you'll find an answer, you'll find one person that something worked for, and it just snowballs. And yeah, it is families who are really struggling to get reliable advice. And the healthcare system is such that it's hard to get into a pediatrician. You can't go into ED. How do you see a dietitian quickly and easily and reliably? So it's so many things. And so I'm really glad that you asked me to jump on for us to address some of this stuff.
Eczema management, let's start with that because that is one of my passion areas and something I've really only upskilled in probably the last couple of years. And it's really blown my mind to see some of the information out there that is just blatantly wrong. Talk to me about what you see, what's coming into the clinic, what are people being told?
Yeah, so look, I do an allergy clinic, and I have to say that a very large number, like I'm talking upwards of 25% of my patients come in with eczema and looking for food-related causes to eczema. And so we're now doing a bit of a pseudo dermatology clinic as well because eczema and allergy are so interconnected, but also not in the way that families expect. So a lot of families are told and expect and see on social media that food causes eczema and therefore cutting out food will fix eczema. And that is just incorrect advice.
Okay, so maybe we can just start with what eczema is for those families who maybe haven't experienced some of the trauma of eczema. What is it and what does it mean?
Yeah, sure. So eczema is a genetic condition. It's in the family of atopic disease, and that involves eczema, asthma, allergies, and hay fever. And so once someone in the family, particularly first degree relative, has one of those conditions, you're just at a slightly higher rate of having any of those conditions. And eczema is essentially a genetic defect in the skin barrier. So for some reason, the child or the adult skin is not optimal, and that means that the skin is prone to getting dry. It doesn't stay moist, which sounds really trivial, but it is really important for skin that it is moist and that the barrier stays intact. So kids with eczema have, in its mildest form, dry, itchy skin. In its most severe form, awful, angry, infected skin. And what I have seen in my clinic over the last year is just the impact on the quality of life that eczema can have. Poorly controlled eczema can lead to poor sleep, poor growth, really angry, upset kids who are just constantly irritable because their skin is just so angry. And yeah, in its worst form, we see kids who don't grow because of their bodies just constantly, inflamed in their skin. And I'm just putting this in the most simple way. And really good illustrations of that is families who we've managed the eczema, and you're literally seeing a new kid. I've had a 4-year-old come into the room and say, or the father of a 4-year-old come in and just say, "You have changed our life." And all we've done is manage eczema, but for this family, it means that the child is now sleeping through the night. They're not embarrassed to go to school and wear their school dress to school. They can go swimming with their friends. Like, it just makes such a big difference. And I've seen, even just today in my clinic, I've seen a little bub who was on quite a restricted diet, and we'll go into this in detail, who we've managed their eczema and now they're eating everything. And the mum was just so grateful. So eczema is, yes, it's a skin problem, but it's so much more than that.
Yeah, and I do think it's one of the ones that has the wildest treatment options. Like the things that people are suggesting are so far from what is actually evidence-based for these kids. What do you see? Like, what do people present with when they're coming in? What have they tried?
Oh, look, the most upsetting thing that I see is food restriction. So I see families who are on wild goose chases trying to figure out which food is triggering the eczema. So the worst is breastfeeding mums who are literally eating chicken and rice, and that's it, because they're just on this search for what's making the baby's eczema worse. So that's probably the worst, I think, in terms of maternal mental health, and then in children who are excluding what that means for allergy, developing allergies later on in life. So that's, for me, the most concerning and the most medically unsafe advice that I see. But then there's also all the other things in terms of skin products. And I see families come in with, they spent hundreds and hundreds on all these fancy products with all these things that I have no idea what's in them. And really all you need is a really simple hypoallergenic cream from the chemist. So there's a huge range of advice out there, but definitely the food restriction advice is the most concerning for me.
Let's talk about those two things that you've raised, because I think it makes a lot of logical sense for people to think or to be told. Like, if your baby is having, eczema on their skin, you want to look for the root cause of it, and then you want to eliminate that root cause so that they can have improved skin. What is wrong with that as a statement? Talk me through the evidence.
Yeah, look, the first thing to say is I completely agree with you. And I think, logic would have it that if something flares up something, then you stop whatever it is that's flaring it. So I definitely see how the logic can be formed with that. The problem is the root cause of eczema is a genetic condition. You can't fix it. You can't make it go away, but you can manage it. And the management of that is not to upset the triggers and not to withhold the triggers. It's to manage the actual problem. And the way that I liken it to families that I think makes sense is that, say you've got exercise-induced asthma. Okay, every time you exercise, you wheeze. You would never tell a patient to never exercise because that's just awful advice. Exercise is important. You would say, let's manage the asthma. Let's sort out your lungs so then you can exercise. So the next time you exercise, it won't trigger your wheeze. So in the same way, I don't say, sure, if the dairy makes your eczema worse, let's just stop dairy. We'd say, let's try and get on top of the skin. Let's manage your skin barrier, and then you can have as much dairy as you want. And that is exactly what I see in my clinic. We manage the eczema sometimes really aggressively with lots of steroids and all sorts of things, but you get the skin better. And then I am yet to see a child who's then had such a severe flare of eczema once they've reintroduced the food again. What I do see sometimes is children who then develop the other type of allergy, which is your hives and swelling, because they have avoided the food for so long. And that's what we're trying to, our conversation today is we're trying to stop that happening because the risk of withholding food is much higher than the risk of managing eczema.
I think that's something people don't understand, too, is that if you eliminate a food and your baby or your young child is not eating that for a long period of time, and then you reintroduce that food in the future or they have it in the future, the chance of them having an allergic reaction is actually a lot higher than it was, particularly for these eczema kids who are already prone to food allergy just because of that genetic predisposition. So it's really risky advice if you have a baby or a child with eczema to actually exclude a food that they are not allergic to that is just triggering the eczema. It is actually really increasing their risk of developing an allergy at some point in their life to that food. And I think that's if you're getting advice about eczema that is around elimination, I would really want to make sure that that advice considers this as a risk and that that person is appropriately qualified to give you advice around managing eczema and food allergy. Thinking about these families who perhaps their child is having a food like cow's milk in their diet, so some form of yogurt or cheese, and they're seeing this flare in eczema, are there any other symptoms that you would be looking for to suggest that it's more than just eczema for these kids?
Yeah, absolutely. So, look, there's food that triggers eczema, but then you can also have what we call an IgE mediated reaction. And that's the one that everyone worries about, the hives, the swelling, and in its worst case, anaphylaxis, which is involvement of the respiratory or cardiac system. Okay, so wheeze, persistent cough, hoarse voice, and swelling of the vocal cords. So that's your IgE mediated reaction. That's the allergy that everyone is worried about because it's immediate and in its worst form, it's life-threatening. Then you've got other non-IgE allergies, and I say that with inverted commas, things like eczema flares with food, upset stomach with food, like what you see in sort of your lactose intolerance type picture that people like to throw the label around. Sometimes some vomiting, worsening of reflux, and diarrhea. So more of your gut and your skin symptoms that are delayed onset, they're not life-threatening. And yes, when you eliminate the food, you don't have the symptoms, but it doesn't necessarily mean that you're truly allergic to it. So, and it's not uncommon that you have both. So I see a lot of kids who have purely eczema non-IgE, so eczema skin or gut symptoms to a food. And then I see some kids who have that plus some hives, or they get some swelling and a flare of their eczema at the same time. So you can definitely have both. Things that make me more worried that it's more than just eczema. And again, that's in inverted commas because eczema is not a simple and nice thing either. But that's your hives, particularly where the food hasn't been touched. So it's not uncommon in kids with eczema to get reactive skin where the food has been touched. So I would occasionally see kids who get hives around the lips when little bubs are sort of, putting egg all over their face. They get eczema plus a couple of hives. Sometimes you get a bit of localized swelling, so a little bit of lip swelling where the food has touched, but nothing else. What we're worried about more with the IgE reactions is what we call a systemic reaction, so a whole body reaction. So you're seeing hives elsewhere where the food hasn't been touched, generalized swelling, or anything else internal from the cardiac, which for little babies is, they go pale and floppy, or respiratory, which is that hoarse voice, persistent cough, wheeze, or noisy breathing. So you can absolutely have both, and it's not up to parents to have to decide that. So I think it's really important to seek some professional advice. And if at any stage you're worried, managing it with antihistamines, calling the ambulance if you're worried is absolutely fine. But it is not uncommon to see an immediate eczema flare with food. And as long as it doesn't have the other symptoms like the hives, the raised rash, or the lip swelling or throat problem, then you can be pretty confident that we're looking at a non-IgE eczema flare to food, as opposed to the more concerning type of allergy. Does that make sense?
It definitely does. And when you're talking about this kind of specific eczema flare, I hope the key message that's getting across is that actually it's about appropriate skin management rather than then avoiding that food in the future.
If it's clear that your child has some egg and then the eczema gets really bad, you might want to hold off on the egg for a couple of days till you get on top of the skin and get some really good advice on skin management. But I would definitely not be going on a wild goose chase trying to cut out all different types of food, having prolonged avoidance, because that prolonged avoidance is when you see them then flicking into the other type of allergy.
Yeah, wild. And you mentioned before around the kind of sometimes aggressive treatment with steroids on the skin. And I think that even just the word steroids really bothers people. It feels like, oh, couldn't we do something more natural, or is this safe? And it talked me through what you tell families, because I really strongly believe in the evidence around this, and obviously you would too. So talk us through it.
Yeah, look, steroids work. Okay, so that's the bottom line. Steroids are really, really good at dampening down inflammation. We use it for so many things, and we absolutely use it all the time in eczema. And part of the problem is that there's always been this use sparingly advice that's been, even if you get a script for a steroid, it says you apply sparingly on the skin. The problem with that is it just doesn't treat it properly. And so we kind of, and if you speak to a good dermatologist, they will tell you should be going through tubes of this stuff if you've got really severe eczema. You want to be doing a nice thick layer on top of the angry, inflamed skin. And the evidence around, there is some concern about sort of skin breakdown and weakening of the skin and changing color of the skin. A lot of that is because of chronic eczema, to be completely honest. I see much worse long-term effects of chronic eczema than I ever have with long-term steroid use. And if you're using it safely, you don't need to use it for that long. And it's much better to sort of go hard for a week and then not have to use it for another 6 months than to use a little bit every single day for 6 months. And yeah, like I said, so a lot of that, the sort of skin color changes and stuff you see is actually from the eczema, in the chronic inflammation and the skin. So a lot of what we do in medicine is risk benefit. And sure, if you've got perfect skin, I'm not going to tell you to use a steroid. But if you've got severe eczema, then I think the risk of using steroids on your skin versus the risk of having chronic eczema for comfort, for food, for everything else is just definitely outweighs that risk.
I think this reflects some of the misinformation as well, because one of the greatest analogies I've heard is if you think of eczema like a bushfire, that when it's like really covering the skin, it's an obvious bushfire, you obviously want to put that out, right? But you don't want to leave any of these little kind of burning embers that can then trigger another bushfire. And what I think families struggle with is this, like, oh, it's mostly gone, so I'll stop using, whatever it is. And that just kind of keeps this cycle going, doesn't it? It just feeds the eczema, the skin never properly heals.
Yeah,
And
absolutely.
then you've got these ongoing risks.
I love that analogy. Can I steal it?
Yeah, it's all yours.
Um,
I actually
but
think I
yeah,
stole it from Gemma, so it's
oh, there
yours,
you
but I'll pass it
go.
on.
Um, exactly right. And I actually often tell families, if you can see the skin better, that means you've touched the top few layers of the skin, but we haven't got to the bottom few layers. There's lots of layers of the skin. So I will not infrequently see kids who don't, to look at them, they don't look like they've got eczema, but the parents say all they do is itch. They're just sitting there all day itching. It's because those layers underneath aren't healed. So I would often give these kids some really aggressive eczema management still because and you want to keep going with it until you're confident that all the layers of skin have had a chance to dampen down that inflammation. So I see heaps of patients who GPs prescribe steroids, have used the steroids, the day after they stop, it comes back. And that's because we haven't got to those layers underneath. And exactly like you said with the embers, it flares right back up. The other thing with steroids is there's always a bit of a rebound effect. So when you stop the steroid, it does rebound and come back. And so I will always wean it. And the evidence on that is a bit here nor there. It's very much my anecdotal evidence, but I feel like it works well. I'd go sort of twice a day, once a day, every second day, and then wean it to kind of dampen down that rebound effect and really get to all the bottom lower layers of skin that you can't see that are still impacted.
Interesting. One of the questions I get commonly from families where they're introducing solids and they know that if their baby has eczema, they're at an increased risk of developing a food allergy. And so the advice is very much get that eczema under control before you do those common allergens. How long are we talking? Like how long, if with appropriate treatment, would you expect would you expect eczema to be under control to the point that they could do the allergens?
I'd say until it's visually clearish. So some kids can take quite a while to have perfect skin. You don't have to chase perfect skin to do allergen introduction. But kids who have active eczema, so you can see the red scaly patches, the itchy, and the eczema is bothering them. So symptomatic eczema, I think is definitely, if you can avoid a new food introduction at that time, I would, because the chance of having a heightened immune response at that time is quite a lot higher. And for example, when we do skin prick testing in the clinic, we don't skin prick test if there's active eczema. Active eczema on the back, especially, which is where we mostly do the skin prick test. But anyone who's got severe eczema, we just do not skin prick test. We send them home and get them back once eczema is under control, because a skin prick test with poorly controlled eczema can be falsely much higher than a child who's got reasonably well controlled eczema. So you're not looking for perfect skin, but you don't want it to be symptomatic. So itchy, red, angry. Ideally, you want to dampen that down before you start your new food introductions.
And I do think if you're not treating it appropriately, being given some poor advice for whatever reason, that can drag on for weeks and weeks, right?
Yeah.
We should be talking days more than anything for most babies to have that under control enough with appropriate eczema treatment.
Yeah, ideally. I mean, look, there's an eczema
There's
spectrum, but
always,
most eczema that you see with the right management, you can get on top of it to a point where you could introduce foods within a week.
yeah, great. Love that point. Let's talk. We kind of mentioned some of the allergy skin prick tests. Tell me, I mean, I feel like this is a big area as well. There are so many places where you can send your baby's hair off to have it tested. There was
Oh,
actually at the recent expo, I was at a baby expo, there was a company doing saliva testing for babies to tell you if they have an allergy. And I
yes.
was just like wild with rage because tell me why. Tell me why this is so inappropriate, would you?
I'm just going to have to take a deep breath because this is my pet peeve. And I honestly, I don't even know how these companies exist, how they're allowed to exist, and who approves this. But I have families who come to me with, I think that the most recent one I've seen is a blood test that tests for 400 plus allergens. And I'm talking like American blue scorpion, like I don't even know where these things exist. And they literally test for a kale, like every single fruit, vegetable, meat you can think of. I don't know how these companies work, to be honest. So I'm just give me a second to just dampen down my rage because I would
I
have
did
felt the
report
same.
this company at the time because I was like, this is fear mongering to its finest. Like you pay me $500, I do this test for you, and I tell you like, oh, your baby's allergic to egg, and the risk, and that is not true. Like that is not based on. To be very clear for people listening, there is no evidence that you can test for that thing. And then these people are avoiding these foods potentially, which actually increases their risk of having a food allergy in the future. It's a self-fulfilling prophecy, which is
Oh,
just so risky.
and they're expensive. And
Oh.
yeah, so look, the reason why these, so I have families come to me either with that result or, and I honestly just very politely say, I'm just going to ignore that and talk to you about the actual history. Um, and then I've got families who come to me asking to do it, and I say, absolutely not, you can go elsewhere. Um, and I literally last week had someone say, why don't you do that? And I said, because it's rubbish. Um, I don't think they'll come back to see me again, but that's right. So look, the reason being is that how would your body know? How would you know if you're allergic to these if you haven't seen it in your gut? Now, look, babies who are breastfed and mums have some are eating these foods in their diet. We don't know how much of that protein actually gets through the breast milk. And either way, it's not a reliable amount for us to say that the child is allergic. And the reason we know that is we have kids who are anaphylactic to cow's milk when they ingest it, but the mums can still drink it and breastfeed and they have zero issues. So you just breastfeeding and maternal ingestion is just not reliable enough for IgE mediated reactions. The only thing really that is reliable is the child ingests it in their mouth, it sees, goes through their gastrointestinal system, and their body has a systemic response. And the only way you can do that is the child eating. So any testing that is done prior to a child eating the food in their own mouth by themselves has a risk of being false. And the reason we know, so the problem is 15 years ago, we used to think that you could screen. And the medical advice and the advice from allergens and dermatologists and pediatricians 15, 20 years ago was if you've had a peanut and you've had a reaction, let's just test you for everything just in case. And I now see these 14-year-olds who have been screening skin prick tests who have come up with positive to all these different things. And now if they see that food, they're going to have an anaphylactic reaction because they've withheld it for 14 years. So, and unfortunately, that's just the way medicine works. We didn't have the evidence back then to tell us that actually that's all rubbish. So since then, there have been massive, massive trials, including thousands of children in Australia that have been in trials where they have skin prick tested before they've eaten the food. They have then given them the food and have proven that the skin prick test is false.
Yeah.
So because they have been able to eat the food without a problem. So the rate of false positives prior to ingesting it yourself is just too high to be worth it. And look, you will go places that will do it because it's good money, skin prick testing. You know, you'll find private clinics that offer it for all range of things. I have colleagues who do that, but it's not good medicine because it's just not true. And so, and again, our advice around introducing food on the skin is the same thing. If you introduce it on the skin, then your body actually has a chance to say, oh, I don't like this. And then when you actually eat it, you can have a full-blown reaction. Whereas if the first time the child eats the food is in their gastrointestinal tract, that is the most reliable way to know if they're allergic or not. And testing after they've had eaten the food, if they've had a reaction that we're worried about, is believable. So I would believe that. But I would not, I would say I never skin prick test a child who hasn't eaten the food, even if they've had a serious anaphylactic reaction to something, unless it is closely related, like cashew, pistachio, or peanut and walnut. Sorry, pecan or walnut. I don't think I ever skin prick test unless they've eaten it. And this is why these blood tests are rubbish, because again, how would you know?
I've worked with a lot of families who have been to see somebody about something kind of unrelated. They've had this blood test done and they've been told, like, oh, your child's allergic to egg. And they're like, oh, we eat egg like every day.
There
So
you go.
are they having, but then as a parent, right, your first one is guilt. Like, oh gosh, I've been giving them egg every day. Do you know, not like, oh, well, that's rubbish science you're doing. Like, actually, your child is
Of course.
tolerating egg and you definitely do not want to cut that out. But it's just, yeah, it's so interesting. Think about this. What about, I'm thinking about a lot of the kids that I work with who perhaps have had an allergic reaction to something like egg or peanut. And then they can't get into to see an
Mm,
immunologist or a pediatrician for a while, and they're really scared about introducing those
yeah.
other allergens. Would your advice be to like continue on as much as you are able, given that that doctor can't do a skin prick test until your baby's eaten it anyway. So you may as well make the most of your money of going to see them.
100%, Carla. I tell kids who are waiting to come in, or so for example, say I've seen a child and we've decided that they're allergic to something, but they still need to introduce everything else. I will say come back once you've introduced everything.
Yep.
Because I'm not in this to skin prick test 5 times. That'll make me much more money, but let's just do what's safest for the child. And yeah, absolutely. As soon as and in my advice for home introduction, I say if you have a reaction to something, stop that and then move on to the next thing, and just keep making your way through it. Write down all the things that they think they've reacted to. Take photos, because photos are gold, and then see someone at the end of all of that to then decide what you need to test to, what you don't need to test to, what you need to avoid. I cringe when I see families who have gone to emergency departments with, a reaction to peanut, and then they're told, "Oh, don't do any more nuts until you see someone," because unfortunately, it's going to take you forever to see someone these days. So yeah, absolutely. If you feel comfortable, I would keep going, and if you can do it safely, then if I can plug the Royal Children's Hospital Home Introduction Guideline is amazing. And you can find variations of that. It's sort of, your 1/8 of a teaspoon your first day, 1/4 of a teaspoon, 1/2 a teaspoon. If you can do that safely over a 5-day course, when the child is well and when their eczema is well controlled, it's a really, really safe way to introduce food. And, the first sign of a hive or anything that you worry about, you give some antihistamines and you stop and you go on to the next food. Particularly less than 12 months of age, the mortality and morbidity from that worldwide is pretty much 0.
Yeah.
In that less than 12 months introductions, it is so unlikely to have a serious outcome from first food introduction. The older you get, the higher the risk is because of that prolonged avoidance. So yeah, once you're less than 12 months, that your prime time to introduce food is less than 12 months, because that's when you're least likely to have a severe reaction. And that's not to say that kids don't. Okay, so I see I saw someone last week that had anaphylaxis to peanut at 7 months, around introduction time. So it's not impossible, but it's very low risk. You'd rather know then than the worst cases I've seen are sort of 5-year-olds who go to a party who's never had nuts, then has a full-blown anaphylaxis, or in its worst form, teenagers who are on school camp who have anaphylaxis, and teenagers die from anaphylaxis. The highest rate of deaths in anaphylaxis is in teenagers with poorly controlled asthma. And I see teenagers who have just been told to withhold food for whatever reason, and the first time they see it is they're anaphylactic. So I don't even know where that question started. I'm so sorry. I've gone on a massive
Mate, I feel it. Like,
tangent.
I feel the frustration around this. Like, I mean, I'm guessing that all of this is well intended. I can't trust that these companies who are falsely testing are well intended. Like, that just feels like a money grab. But a lot of the others are, the
Oh, yeah.
advice is well intended, but it has such ramifications. Like, these are high stakes, do you know?
And look, allergy is scary, and particularly if you've had a child with an allergy and then you've got siblings, and it's really scary to then introduce a food that's caused anaphylaxis in one child to another child. And that's another really common scenario I see, or a parent is anaphylactic to egg and then they therefore don't give their children any egg. But I hate to say, but it's literally the worst thing you could do. The best thing you could do is introduce it early if you know that you're allergic, because you just want to get that in.
What are your tips for those families with a sibling or a child with a family history of allergy?
My tip is get it in as early as you can. I know it's terrifying, and I completely understand that. Look, I'm not going to lie. I see families who say, "Right, I'll do it. I'm just going to sit in the hospital car park and do it." And that's do as you will. But look up the home introduction guideline. Do it safely. Keep your antihistamines. I would say if you're worried, just get some antihistamines and have them at home. I had antihistamines at home when I gave introductions to my kids. I don't know if that's something that everyone wants to do, but if you're worried, just do it. I mean, I see the worst of the worst. So I'm like, yeah, I'm going to have some antihistamines around just in case. And just do it safely, and be cautious in that you don't want to do it when they're sick. So being unwell is increases your risk of having a reaction. You don't want to do an eczema flaring. And then the other time is sometimes sort of post immunizations if their immune system's just going through a lot. So whether that be illness, mounting an immune response to a vaccine, you don't want to do it when you're sort of got a really busy day and you're running around, you can't keep an eye on them. So if you're doing it in a safe, controlled setting when the child is well, it's a really low risk thing to do. And if there is an outcome, it's a really important outcome to know about. So it's really important to know if your child is allergic to something, as opposed to avoiding it because you're worried that they're allergic to something, if that makes sense.
And I think for those parents, like, you have managed it before. You have managed it in yourself or in your other child. You have survived it, and you will survive this next one
Yeah.
as well. We have a lot of clinics here in Perth where there's like the nurses station who will often support parents who are wanting to do the introduction in a safe space with
Yeah.
obviously medical advice on hand. And I think that's a really reasonable thing to ask of your GP surgery if you have that capacity. When
Yeah,
you're talking
absolutely.
about kids being sick and not introducing allergens, let's say your little one has a cold. How long are you talking? Like, when would you? I mean, obviously, it's tricky to tell symptoms sometimes if your child is already, struggling to breathe, they've got a really blocked nose or something like that. What kind of time frame do you think is safe after something like a cold?
Yeah, look, it's hard to know. I guess for me, the main thing is sometimes you can get hives with viruses. And in fact, viral urticaria, which is hives with viruses, is one of the most common causes of hives in children. So I guess as long as you know that whatever illness they've got at the moment is established, so it's not sort of day one and things are going haywire and they've got a fever, and therefore if they get hives, you're not sure if it's because of the virus or if it's because of the food, then I'd probably hold off. But once you're like, okay, this is sort of in its plateau phase of the virus, the fevers have settled, I'm happy that if anything new happens today, I'm going to say that it's food related. That's probably an appropriate amount of time. And it's hard to know if that's a day or a couple of days. And then by the time they're well, they're going to get the next thing. So you do want to sneak it in
Yes.
between those times. So, it's not a hard and fast rule, but I think if a child's got fevers and actively unwell and you're not sure if they have symptoms, if it's going to be, because you can have a wheeze when you've got a virus. If you're unsure whether any new symptoms is going to be virus or infection related or food related, I'd hold off.
Yeah.
I hope that makes sense.
Yeah, that definitely does. And as with anything in parenting, right, there's no hard and fast rule. You kind of got to
Yeah, and
make it.
just and then I also am balancing that with I don't want you to be like it's been a year of childcare viruses, so therefore I haven't introduced any foods. So it's about being sensible. But yeah, just knowing in your mind that what's food and what's current infection.
I like to think of it almost, when you're talking about the plateau, if you're on the up part, like you're in those first few days where you're like, oh, this is only going to get worse, don't do it then. If you're in the like, okay, we're coming down from it, like we're on the
Yeah,
improve, then you're fine.
yeah, agree,
The
agree.
roller coaster of childhood bugs.
Yes.
You have also lived and breathed that, haven't you, with your preemie
Oh,
twins?
oh yes, I had my daughter coughing on me all night last night, which is lots of fun.
Fun times. All right, shall we finish? Let's talk about the flu shot. I have seen
Oh
some of your
yeah.
stories recently. You are
Oh
working with
yes.
some really sick kiddos at the moment. What's your best advice for these?
Oh, get the
Everyone.
freaking vax. Get the vax. I don't know what is going on with the flu this year, but we have seen really awful complications of the flu. Pneumonias, brain infections, really bad vasculitis, like whole body inflammation. There's been a few flu-related deaths. Not in my hospital, but I've heard of some. I've had the retrieval service who have come to pick up some kids from our hospital have said that they have sent so many kids directly to ICU post flu. And I'm going to say that pretty much everyone I've seen is not vaccinated. I don't know that I've seen a child who's had the vax who has had such severe complications. We've seen families where, for some reason, some of the people in the family are vaccinated and some aren't. All the unvaccinated people have been unwell, and the vaccinated people have had a sniffle or some body aches and have settled. Um, so the transmission rate, if you're not vaccinated, has just been so high this year. I'd be interested to see what the actual numbers are, but definitely what I'm seeing on the wards has just been outstanding this year and really scary, to be honest, because I think there is again a lot of fear mongering around the flu vax. I have not seen a single child ever in my career come into hospital from a flu vax side effect. But if you walk onto our ward at the moment, it is all flu complications. I'm talking nasty pneumonias, encephalitis, like really, really bad complications post-flu. So absolutely, if there's one thing you're going to do, I would say get the flu vax every year for your kids, because it is so vaccine preventable that it's just, I can't stress that enough.
It's tricky, isn't it? Because we had to reschedule our flu vaccine a couple of times just from illness. And it's one of those things that like can fall off. And I think if you have got the flu one year, you are never not getting the flu vax again, right? As an adult.
Yeah.
And so like you have to protect your kids with this kind of stuff. Is there a time where you've missed the boat for the flu vax, do you think?
Definitely not now, I'd say. There's still so much flu around. So I would
Yep.
say no. I think once you're sort of getting into summer, then maybe for this year's season, you may as well wait till the next year's season.
Is the advice usually like kind of May? Is that the general?
Yeah, April, May. Yep.
April, May.
Yeah. So that your peak cover is sort of over the peak of the flu season.
Put it in your diary now. April
Put
next
it in your
year.
diary. We do an annual family flu GP appointment, and we just all do it at the same time. The kids watch me and hubby get it first, and then they get it. They get a lollipop, and touch wood, none of them have had the flu. Not to say that you're not going to get the flu.
Yeah.
You can still absolutely get it if you've had the vaccine, but the rate of complications is dramatically lower.
Yeah. Do it. Get it done. Thank you.
Thank you
I
for
feel like
popping that in there. I'm so passionate about that because I've seen so many unwell children.
well, do you know what's interesting? Because I had the flu vaccine with my two kids, and my husband had something on and was like, no, I'll organize it. Didn't organize it. Guess who got really sick when the flu went through? Him, for like a full 2 weeks of like absolutely pathetic behavior. But also he was reasonably unwell. But actually, like we were all totally fine. Like we got sick, but
Yeah.
it was no different really to whatever else was going around.
Oh, that is the perfect example. And yeah, we were the same. We went away and there was flu in the household and all five of us escaped it. So yeah, and I think it's, an adult who has a 2 week muscle aches, fever,
Yes.
illness is one thing, but then when you see a child who has a severe pneumonia or we've seen a child who the flu has triggered a whole body vasculitis and their coronary artery, so the artery in their heart has dilated because of the vasculitis they've got post the flu. And we had a string of these on the wards that we had to treat with immunoglobulin and all sorts of things. And it's all of them were 6 to 8 year olds who had the flu and all unvaccinated.
Wow. All right. Well, I'm putting it in my diary right now. I hope you're listening and putting it into your diary for next year. Make sure you're on top of it. Thank you so much for your insights, your expertise, your just genuine, nice way of explaining things. It's been a pleasure to have you on the podcast.
Thank you. I hope I haven't scared anyone. This is all I'm just really passionate about it and I see the worst cases. So, but yeah.
I love though that we can do something about it. Everything that you've talked to today, there is an option for an evidence-based approach to it. And if in doubt, speak to your GP, get a referral, do whatever you need to do, but do not just, accept X for what it is, or do not just skip your flu shot. Like get onto it and action it.
Yeah. So my take homes would be
summarize for me, would you?
Introduce allergens early. Even if you've had a reaction, there's a family history of a reaction, do it early, do it safely, manage eczema. Don't restrict food because of eczema.
Yeah.
And get flu shot.
Yeah. Where can people find you if they want to get to know you more, follow you on Instagram? What's your options?
Yeah, mostly Instagram. Look, I don't have time to do TikTok and all the rest of it. I'm just on Insta at Dr_Nelu. I barely have time to even post on there, but please feel free to hit me up. And
you do good stories.
Yeah,
I like them. I will tag you, Nelu, in the show notes so people can find you. But thank you for being here.
Thank you. Thanks for having me.
My pleasure.
A huge thanks for tuning in and listening to my podcast. This is all brand new for me, so I'd love to hear your feedback. give me a review or send me a DM. I'd love to hear your thoughts. And above all, I'd really love you to hit that subscribe button to keep listening. Thanks.